Hello and welcome to Ashford.com. You are watching an interesting video on Are you suffering from aching pain because of sore muscles? Should you apply a cold compress first or use a heating pad? Please read this disclaimer carefully. According to a new study conducted by health economists at the University of East Anglia and the Centre for Diet and Activity Research in the UK, walking or cycling to work is better for people's mental health than driving. If you are suffering from aching pain because of sore muscles, what is the best way to find relief? Should you apply a cold compress first or use a heating pad? There are many strategies that can eliminate symptoms of muscle pain, such as transcutaneous electrical nerve stimulation, TENS, or medications, but the two most simple ways are heat and cold therapy. However, which should you use first, heat or cold? According to research published by the Mayo Clinic, the best way to treat sore muscles is with cold therapy first and heat therapy later. Cold therapy. If you have a swollen and inflamed joint or muscle, you should first try and reduce blood flow to the area, which will reduce the swelling and slow down the pain messages being transmitted to the brain. This can be successfully achieved with cold therapy. Some effective ways of using cold therapy include cold therapy for sore muscles. Applying a cold compress provides very effective muscle pain relief. Applying a cold compress to the inflamed area. You should apply the cold compress for at least 20 minutes, every 4 to 6 hours. Do this for 3 days. Soaking the area in a very cold tub, just make sure the water is not freezing. Using a chemical cold pack. A cold compress can easily be made by filling a plastic bag with frozen vegetables or rice and wrapping it in a dry cloth. Heat therapy. Applying heat to the inflamed area will help sore and tightened muscles relax. In addition, heat promotes better blood flow and circulation to the area, eliminating any lactic acid waste buildup. Heat therapy is usually more effective than cold at treating chronic muscle pain or sore joints caused by arthritis. In fact, some clinical studies have found that continuous low-level heat wrap therapy, CLHT, can help lessen muscle and joint pain better than oral analgesics, acetaminophen and ibuprofen. Effective ways of heat therapy include applying a heating pad, applying a heat wrap, soaking the sore area in a hot bath, using heated paraffin wax treatment, using a hot water bottle or warm compress. Heat should be applied to the area for 20 minutes, up to 3 times a day, unless otherwise indicated, as in the case of single-use wraps or patches, which can sometimes be indicated for up to 8 hours of continuous use. References.